This is a presentation by Elizabeth Green on human immunity for Unit 16. When microorganisms such as viruses and bacteria invade the body, an infection can occur. Invasions can usually happen through the nose, mouth, or cuts in the skin. Meningitis, strep throat, and UTIs are examples of illnesses caused by single-cell organisms called bacteria. Viruses, being much smaller than the bacteria, require a host cell to replicate and to survive. Diseases caused by viruses can vary from a common cold to HIV/AIDS to chickenpox. Fungi is responsible for causing surface skin diseases such as ringworm and athlete's foot, as well as sometimes causing infections within the lungs or even the nervous system. Parasitic diseases such as malaria and scabies are caused by parasites. Direct contact, indirect contact, and insect bites, and also food contamination are all ways that infections can be transmitted. Direct contact, being the most common way of transmission, can involve person-to-person contact or animal-to-person contact. Indirect contact can occur when someone with an infection touches something, then someone without the infection touches and becomes infected from the germs that were spread. Mosquitoes and other bugs are a common transfer method for conditions such as malaria and dengue. Bacteria called E. coli can cause food poisoning, making someone very unwell because of contaminated food. The body has 3 lines of defense to protect our cells from infection. Innate immunity provides immediate non-specific defense responses against bacteria and tissue damage. The mechanism prevents pathogens from entering the body and eliminates invaders. The most prominent physical barrier of defense comes from the largest organ in the body, the skin. Consisting of 3 major layers, the skin provides a waterproof covering, preventing chemical irritants, toxins, and organisms from penetrating. Another active defense would be if a graze or cut happens, the skin will form a scab to act as a temporary barrier, preventing infections and helping the skin underneath to heal. When exposed to UV or ultraviolet rays, the body's natural defense mechanism is to produce extra melanocytes to shield the body from sunburn. Mucosal membrane is a soft tissue that has a huge part in immunity and lines the body's canals and organs within the digestive, respiratory, and reproductive systems, providing a lubricated barrier against infectious agents and pathogens while still allowing nutrients to pass through. Inside the gastrointestinal tract, you can find stomach acid, pancreatic enzymes, bile, and intestinal secretions, which all provide a chemical barrier against infections. Contractions of a peristalsis intestines and normal shedding of cells that line the intestines help the removal of both harmful and dead microorganisms. The nasal cavity restricts pathogens from entering the body by providing a sticky mucus, lining the interior of the nose that traps the microorganisms before they can travel into the airway. Tiny projections called cilia are lined in our airways to sweep particles towards the throat to be swallowed into the stomach. The urinary tract, especially for females, is an area prone to infection. This is because the female's urethra is short and provides an easy passage for bacteria to travel into the bladder. Most bacteria will get flushed out in both sexes when the bladder gets emptied. When an injury to the skin occurs, the body will create an inflammatory response. The immune system will send out inflammatory cells to attack the bacteria or heal the damaged tissues. It is an essential part of the body's healing process, dilation of blood vessels forming gaps within the cell wall, allowing an increase of blood flow to the area and creating inflammation, which increases the strength of the immune system's response. Inflammation, being one of our second lines of defense, is very important for the prevention of damage to the area and promoting the healing process. Often inflammation can appear red, swollen, warm, and painful due to the increase of blood flow and proteins at the site of infection. Leukocytes are the cells that are involved in seeking out and destroying disease-causing organisms or substances. An example would be a macrophagous. The role of macrophages are to sense and respond to environmental challenges and pathogens to help with tissue repair after injury. They are specialized cells that respond to signals originating from the injury and play a vital role for the immune system. They can form different structures and modify themselves in order to effectively deal with specific infections. Macrophages sound an alarm to trigger dendritic cells to respond and travel to the site of infection. The cells phagocytose and remove small parts of the pathogen, then carry them to the lymph nodes to begin the process of acquired immunity. The acquired immunity response involves two main types of white blood cells, called B cells and T cells. They are a vital part of the response to foreign invaders. The function of B cells is maturing into cells that produce antibodies to prevent the antigens from traveling further around the body. They do this by working with and providing signals for the T cells. The body produces millions of different T cells, and each cell recognizes a different type of pathogen. When the dendritic cells reach the lymph nodes where the T cells are fully mature, they bring them to the pathogen to eliminate the infection. Immunoglobulins are proteins that are bound to antigens. It's made up of 4 chains, 2 lighter chains and 2 heavier, hence the Y shape to the structure. They have many functions, including targeting the infection, recruitment of immune cells, neutralization of toxins, and removal of antigens. There are many variations of immunoglobulins, IgG, IgA, IgM, IgE, and IgD. To have an effective immune system, it must have the ability to determine self and non-self cells in the body. Non-self cells would be bacteria, viruses, and antigens, which are attacked and destroyed by the body's immune system. The tolerance is known as the lack of immune response against the body's tissues. When an organ in the body malfunctions, an organ transplant can be carried out as a healthy organ is given by a donor, and the procedure can often be life-saving. However, the immune system will sometimes view the donor organ as a foreign material and may not recognize the antigens present, and could potentially initiate an attack, so the immune response of rejection to a transplanted organ will follow. To prevent the body from attacking the transplant, immunosuppressive drugs will be administered to help gain the tolerance of the transplanted organ. Rejection of the transplant is down to the immune system's response to the T cells, which attempt to attack and destroy any foreign material in the body. Tissue typing is a procedure where physicians will try to closely match both the organ donor and the recipient to increase the chances of the body accepting the new organ. There are 3 types of rejection, including hyperacute. An example of this would be the wrong blood type has been given, the tissues must be removed right away. Acute rejection can occur at any point from week 1 to 3 months after, and it is common for all recipients to have some amount of acute rejection. The chronic rejection is where the body will slowly damage the transplanted organ, taking place over many years. Autoimmune diseases can occur all over the body, causing muscle ache, fatigue, low fever, and inflammation. When the immune system isn't functioning correctly, it can cause disorders such as allergies and autoimmune diseases, as it starts to respond to non-harmful antigens created by the body, so essentially attacking its own cells. Self-tolerance is when the immune system is unable to recognize self-produced antigens. Rheumatoid arthritis is a long-term condition causing pain, swelling, and stiffness to the joints, usually affecting the hands, feet, and wrists. Over time, the damage caused to the joints can be quite severe, and most common in women and smokers, as well as people who have a family history of autoimmune diseases. However, the symptoms can be treated with medication and physiotherapy. Surgery can also be an option for correction of joint problems. Another specific and common immune system disorder would be multiple sclerosis. a lifelong condition that can develop at any age, affecting the brain and spinal cord by causing a range of symptoms such as problems with vision, arm and leg movement, sensation, and balance. There are two types of MS, the most common being relapsing MS. This is where an individual will have relapses of new or worse symptoms over a period of time. Treatment of MS can involve short courses of steroid medication and using medicines called disease-modifying therapies. Unfortunately, there is no treatment that can slow the progression of this disease currently. Adaptive / active immunity occurs in response to being infected with or vaccinated against a microorganism. The body will create an immune response to prevent any further infection with the microorganism. When a person receives antibodies to a disease or toxins instead of creating them through the body's immune system, it is called artificially induced passive immunity. This process can only last a few weeks as it's borrowed from another source. Natural passive immunity can occur through a mother's breast milk, giving temporary immunity to a baby as they are then exposed to diseases through the mother. It's where antibodies are passed on through person to person. Innate natural immunity is something everybody is born with for general protection. The immune system recognizes when certain invaders are foreign and could be dangerous, so the body creates barriers in order to avoid any germs from entering. When the body is introduced to antigens via a vaccine, it causes a reaction to stimulate the production of antibodies as well as memory cells to provide immunity. As the vaccine contains a small amount of pathogen which imitates a certain infection, this provides the immune system with an advantage to fight off future infections. It's a much safer option for the body to be exposed to the disease through the vaccine than catching it and having to treat it. Immunological memory happens when the body becomes naturally infected with occurring antigens after having the vaccine. The immune system will then have the ability to respond, attack, and destroy the pathogens before symptoms develop due to the recent encounter. Herd immunity is where a high percentage of people are vaccinated, making it difficult for diseases to spread due to the very few people within the community who can be infected. This provides a good measure of protection for babies, elderly people, and vulnerable people to stop the spread of some contagious diseases that these certain people can't be vaccinated for. If the herd immunity breaks down due to the immunization rates falling, there will be an increase of new cases. A number of problems can occur during an outbreak of infection. Pathogens can present different variations of the disease, causing the body to struggle with protection against all antigens. Unlike vaccinations, the herd immunity does not offer a high level of individual protection, so it's not a good alternative to getting vaccinated. Vaccination programs exist for adults and children to ensure uptake is made as convenient and accessible as possible. Usually vaccinations are carried out by health visitors, nurses, or GPs. Children get vaccinated throughout different times in their childhood, covering diseases such as tetanitis, polio, measles, rubella, and mumps. An example of a worldwide immunization program is the COVID-19 outbreak, which is currently still ongoing. Key factors affecting vaccine uptake is lack of trust in organizations and individuals who advise on or promote vaccine uptake. Lack of culturally and linguistically appropriate information and inconvenient locations and timings of vaccine appointments. Other factors that can disrupt the effectiveness of vaccination programs is the involvement of certain groups known as anti-vaxxers, as they believe vaccines can cause more harm and other diseases than doing good. A vaccine called MMR had been linked to the development of autism, claimed by a published article in The Lancet in 1998. This caused a number of people refusing the MMR vaccine for their children. Research has concluded that there is no such link. However, because of the stigma behind it, the decrease of immunizations have led to an increase of the infection. Vaccinations are very important for protecting our bodies from serious and potentially deadly diseases. They prevent up to 3 million deaths worldwide every year. Diseases that used to kill or disable millions of people, such as polio, smallpox, and tetanitis, have all become extremely rare since the vaccination was introduced. Vaccines stop the spread of infectious diseases. However, if people with access to vaccines refuse or delay having vaccinations, it can be a big threat to global health. Overall, vaccinations have become a key component of healthy living. Without them, our immune systems won't create the antibodies to protect our bodies from diseases. This concludes my presentation. Thank you.